Let us now look at the characteristics of fee-for-service and bundled payment models. I found this beautifully summarized in Economist, and I'm going to use that summary to examine the pros and cons for these payment models. So fee-for-service. The characteristic is that the payment is for each unit of care. The pros, this is well established, is the most dominant model currently, and the fee schedules are clear. There are no restrictions, if any, on the quantity of patient visits. But obviously, there's a problem. A, there's a very high financial cost to the overall system. Number two, there's almost minimal, if nothing, financial risk for the provider, both to the hospital and to the doctor, other than reputation. There are very little incentives for providing quality of care. There are no incentives for efficiency because inefficiency is also getting paid either by the patient or the insurance company. There is no incentive for care coordination between hospitals, between disciplines, between the providers. And there is an increase in volume of unnecessary care because there can be incentive to profit from overtreatment and overdiagnosis. Let us look at the characteristics and the corresponding associated pros and cons of bundled payment characteristics. So bundled payment is basically the sum of individual unit of costs of care into one overall payment for the entire episode in that value chain, unlike fee-for-service, which is encounter and isolated events. The pros is definitely more efficient than FFS, fee-for-service. There is an incentive for lower cost of care. There is definitely an incentive for higher quality. The costs are more clearer upfront, which is great for the patient and for the consumer or for the insurer. Today, you don't know what your bill is going to look like until after the procedure is done and you're waiting to get discharged. There is an incentive in this model for hospitals to establish stronger relationship with its doctors, providers, and other departments. And there are risk-adjusted payment options. What are the cons here? Obviously, for the hospital, the risk increases because it shifts. The risk shifts a little bit from the patient to the hospital. I would say fair enough. However, there is an incentive for hospital to avoid high-risk patients. Also, there is incentive for increasing the volume of services. It doesn't completely go away. And because there is this incentive for avoiding high-risk patients, it tends to favor common procedures where the chances of something going wrong or outcomes going pretty bad is lower. So far, there's been limited evidence of this payment model working for chronic conditions, and the shift cost in separately paid portions of overall care. This summarizes the pros and cons for the fee-for-service and the bundled payment model. We will now examine the characteristic and the corresponding pros and cons for the other four payment models. Up next.